Hello everyone, and welcome to Group 8's presentation for Prevention and Rehab Complex Chronic Conditions. Today we will be talking about asthma. The Ministry of Health and Long-Term Care defines a chronic disease as a long-term disease. It develops slowly over time and often progresses in severity. A chronic disease can be controlled but rarely cured. Chronic conditions often impair one's physical and mental functions. They can reduce one's ability to perform daily lifestyle activities. Our presentation will begin with some basic background information about asthma, describing the condition, its main symptoms, and distinctive characteristics that finally discuss how the condition is complex. After that, our presentation will look at current trends in Canada and worldwide. As you will learn through our presentation, asthma is complex because in most cases there is a presence of more than one disease. In addition to discussing comorbidity, we will look at what all it affects and how presence of asthma triggers it. To end our presentation, we will discuss some final factors pertaining to asthma such as healthcare utilization, environmental factors, and rehabilitation. Finally, we will take a look at how asthma can result in obstructive sleep anemia syndrome, a publication that examines the effectiveness of a strategy or program related to rehabilitation. We hope you enjoy our presentation, and let's get started. The basics of asthma. This slide is just a brief overview of what exactly asthma is. It is a chronic lung disease that inflames and narrows airways. It causes recurring episodes of things like wheezing, chest tightness, shortness of breath, or coughing. Currently, there is no cure, but treatment is available and it can very often be controlled. And finally, asthma is often associated with chronic rhinitis and sleep anemia, and among others. What makes asthma a chronic disease? So, a long-term disease that develops slowly over time. It has to be more than 6 months to be recognized as a chronic disease. You can be born with asthma or it can develop later in life. Currently, there is no cure, but it can be managed with treatment and lifestyle changes. And impairs daily activities, so your physical health with over-exaggeration causes shortness of breath, or even your mental health. Reduced oxygen causes fatigue in an individual.
When looking at descriptive epidemiology, it is important to address the person, the place, and the time with regards to the specific disease, illness, disorder, or condition. As we can see, this graph found on the Government of Canada websites illustrates a strictly Canadian trend when it comes to asthma and the various populations affected from the years of 2011 and 2012. The y-axis is the prevalence percentage, or the disease burden, while the x-axis is categorized into various age groups. It is clear to see that in Canada, younger populations between the ages of 5 and 24 have higher prevalence rates compared to the older population. In fact, in a 2014 study, it was found that of the 3 million Canadians diagnosed with chronic asthma, 600,000 were Canadians less than 12 years of age. In addition to this, for the total population, Canadian females have higher prevalence rates than males. We can see this trend on the graph as well. The male population, as shown in the green, only shows a greater prevalence until the 19 to 24 age category. Everything after that shows an increase of prevalence in the female population, as shown in yellow. It is important to note that rates of asthma in Canada continue to grow, making it the most common chronic condition in children and the third most chronic condition in all of Canada. In this slide, we address the geographical trends seen in Canada with regards to asthma prevalence. There is an increased prevalence of asthma in Ontario, Manitoba, and Nova Scotia, although the overall prevalence is relatively even among the rest of the provinces. On the other hand, the territories showcase a decreased population of individuals living with asthma. There are several various risk factors that can contribute to the geographical distribution of chronic disease. The most common include tobacco smoking, in- and outdoor air pollution, urbanization, occupational risks, family history, and obesity. On this slide, I wanted to briefly compare and contrast the trends previously mentioned in Canada with the rest of the world. Compared to the 3 million cases in Canada, there are over 300 million people living with asthma across the entire globe. As showcased by the distribution map on the left-hand side, there are several other parts of the world that have higher prevalence rates, including Australia and New Zealand, and various countries within Africa and Asia. A risk factor that can that can explain the presented global distribution is the difference in climates. Research suggests that those living in extreme climates, along with increased dampness and humidity, have a greater risk of developing asthma. On the right, we have another graph that showcases prevalence rates grouped by age and sex. On the y-axis, we have various age groups, while on the x-axis, we have the burden of disease, as measured by DALYs, or disability-adjusted life years per 100,000 of a population. We can see that the global trends tend to differ when compared to Canadian ones. There is a slight increase in the younger populations, but the age groups with the highest prevalence start at the 60-year mark. Overall, there seems to be no sign of a declining prevalence worldwide. The numbers continue to rise despite improvements made to healthcare access and the production of various asthma treatments. This is likely due to the continuous increase of pollution and smoking, along with the expensive medications and the treatments that are only available to certain populations, primarily those in first world countries.
One of the themes that makes a condition complex is the presence of more than one disease, also known as a comorbidity. As we know, the risk of developing chronic disease increases with age. However, since many individuals with severe asthma are diagnosed during childhood, the chances of asthma patients developing a comorbid condition is very likely. A few of the most common comorbidities associated with asthma are rhinitis or sinusitis, gastroesophageal reflux disease, also known as GERD, obstructive sleep apnea, chronic obstructive pulmonary disease, hormonal and metabolic disorders, and various types of mental illnesses. In the following slides, we will focus on gastroesophageal reflux disease as an additional entity to asthma and in more detail, along with rehabilitation strategies.
Another theme when discussing the chronicity or complexity of disease to consider is the healthcare utilization by these individuals. The healthcare that is utilized by patients suffering from asthma include hospitalization, emergency department visits, unscheduled outpatient visits, scheduled outpatient visits for preventative purposes, and subspecialist care such as seeing a respiratory therapist. Taking into consideration that asthma is a chronic inflammatory disease that tends to present itself for a lifetime period with increased severity in later age, the utilization of healthcare spans for most of their life if the condition is not managed. In a study done by Nunes Pereira and Murray's Almeida in 2017 found that healthcare costs for patients with asthma increased with the increase in disease severity. Asthma is considered one of the top chronic conditions that cause disability-adjusted life years, which would mean that they require management both by the clinician and by themselves to manage everyday life activities. Asthma can be considered a significant public health problem because it often requires the use of emergency care, including being admitted into the hospital. In addition, it can be responsible for early permanent disability or premature death. Overall, asthma-related costs are very high. Recent research shows that the medical expenditures attributed to asthma were significantly higher in uncontrolled diseases when compared to those without asthma. For instance, individuals with uncontrolled asthma were 4.6 times more likely to have frequent hospitalizations and had up to 1.8 times higher of a number of frequency in emergency department visits. The increased likelihood of these incidents are what make healthcare utilization significantly greater in those with uncontrolled asthma, and therefore increasing healthcare costs. Overall, the substantial costs would be reduced with the proper management of asthmatic patients. Another theme that contributes to the complexity of this chronic disease would be the environmental factors that can have an effect on the impact of this disease. These environmental factors can act as triggers that can cause the onset of an attack or exacerbate the condition. The burden of asthma can be influenced by and is associated with environmental factors such as environmental tobacco smoke, also known as secondhand smoke, outdoor air pollution, dust mites, and bad weather conditions such as high humidity and freezing temperatures. These can all influence the severity and complexity of asthma as a chronic condition by worsening the condition or making it more difficult to control than what can be done through self-management alone. According to Centers for Disease Control and Prevention, researchers have found that there is a high association of increased hospital admissions and exposure to particulate matter, which is an outdoor air pollutant. Particulate pollution can be present in the case of calm weather where air pollution can accumulate near busy roads or factories, or where smoke from wood stoves or fireplaces is present. Studies have also shown that individuals with asthma that live in cities near factories or near main roads or highways are more likely to suffer from frequent asthma attacks as opposed to someone with asthma that live in suburban areas.
The secondary illness to asthma that we will be discussing is obstructive sleep apnea syndrome, or OSAS. OSAS is a condition that obstructs the upper airways so that they become blocked during sleep. The symptoms and signs of this disease are snoring or gasping during sleep, reduced or absent breathing during sleep, excessive exhaustion during the day, and lastly, dry mouth or headaches when walking.
Now that we've looked at OSAS, I think it's good to look at a rehabilitation program. The rehabilitation program we'll be considering is continuous positive airway pressure, or CPAP. CPAP is considered to be one of the most effective treatments for sleep apnea and is quite frequently prescribed. It uses a device that is pictured there. It uses a mask that's hooked up to a machine that pulls in the surrounding air. It delivers constant, steady air pressure to the lungs and increases the mean airway pressure so that the person continues to breathe throughout the night. It uses the perfect amount of air pressure and relieves the obstruction that is causing the sleep apnea. CPAP has also been proven to improve the response to drugs for asthma and other bronchial problems that the person might also be facing.
So, as you guys know, obesity is steadily becoming a major public health concern in North America, with rates continuing to climb. And children are increasingly being affected. So, the prevalence of childhood obesity has more than doubled in the last 20 years. Obesity is known as a risk factor for obstructive sleep apnea syndrome. So, obstructive sleep apnea syndrome is characterized by repeated episodes of upper airway occlusions that results in brief periods of breathing cessation or in a marked reduction in airflow during sleep. Continuous positive airway pressure, so CPAP, is the first line of therapy for sleep apnea and is considered to be the most effective treatment to suppress sleep apnea-related symptoms. Clinical improvements after CPAP treatment is directly related to major reduction in respiratory events and their related consequences during sleep. So, the research article has gathered information in regards to the beneficial effects of CPAP concerning improvements in asthma symptoms or gas exchange. These benefits using CPAP includes mechanical and neuromechanical effects, gastroesophageal reflux suppression, local and systemic anti-inflammatory effects. This includes suppression of increased serum levels of inflammatory cytokines, chemokines, and CPAP has also shown improvements in cardiac function, leptin level suppression, weight reduction, and sleep restoration. So specifically, CPAP eliminates or reduces the chronic intermittent hypoxia observed during apneic events. Over here, we have an article that reveals a strong correlation between asthma and obstructive sleep apnea syndrome. This literature review discusses the impact of asthma symptoms of treatments of continuous positive airway pressure, also known as CPAP, in patients with both conditions. So, after reading this article, the results of the compiled study show that there is a strong correlation between the condition and disease, and CPAP therapy for obstructive sleep apnea syndrome modifies the airway of smooth muscle function and asthma control in patients with both disorders. The study we used to determine the relationship of asthma and sleep apnea with CPAP used a systematic review. We use the article because it is considered to be the most reliable source of information because it examines many different studies. The study used many reliable databases such as Ovid, Medline, and PubMed to make their conclusion. Thank you for listening to our presentation. I hope you enjoyed it, and here is a list of resources that we used to help with our study in PowerPoint.